Sodium bicarbonate supplementation for resistance training athletes. Dr. Poster, Dr. Schilling, Dr. Navalta, and me, Carl Munninger. So we have in the outline, you have an introduction, a purpose, some methods, and expected or anticipated results. So sodium bicarbonate supplements will be ingested as an ergogenic aid before resistance training, and we'll have bench press movement tasks for 3 consecutive weeks. Methods include subject experimental design, experimental procedures, data analysis, statistical analysis. Sodium bicarbonate is a basic or alkaline molecular substance. It forms the atomic structure of NaHCO3. It exudes a bright and pure white color at room temperature and sea level atmospheric pressure. It doesn't supply any caloric energy, so it does not contribute to any kind of energy storage. It's also can be referred to as sodium hydrogen carbonate or baking soda, and bicarbonate ions and hydrogen protons can be consolidated together to form carbonic acid H2CO3, carbon dioxide CO2, and water H2O in cells, and it can be considered an ergogenic aid. The timing is crucial. For endurance, the successful events have been achieved between 1 and 7 minutes of time, and the supplements are consumed 90 minutes or an hour and a half before cycling, running, swimming, or other endurance event. However, they're exerting high intensity. It's not like a walk in the park. It's not easy. It takes a high level of painful effort, so it's not something that's simple and comfortable. It's not comfortable. So so the sodium bicarbonate should reduce fatigue, and so you have this issue with gastrointestinal distress. You see the picture of the stomach there, and the advantage of the serial loading scheme is that it's dispersed over a 4-day period, so the cells have time to physiologically adapt with protein synthesis and diffusion activities, phosphorylation, whatever. And so 2 studies have demonstrated that sodium bicarbonate can improve resistance training by the amount of work that can be done at high intensity. So 2 studies have verified the success of sodium bicarbonate supplementation for resistance training. And however, they haven't demonstrated the serial loading. So that's the purpose of this project, is to demonstrate serial loading for resistance training events like bench press movements. And obviously athletes will need to be hydrated. So there's the consequence of sodium bicarbonate ingestion is that it will allow the efflux of acidic hydrogen proton cations from the intracellular fluid to the extracellular fluid, or from the sarcoplasm to outside the cell, and so that reduces the acidity and makes it more balanced environment, or more alkaline. And so the idea here, the concept is to increase total repetition counts while also abandoning or absconding away from gastrointestinal distress. And so the acute loading will be contrast with the serial loading, while also having a placebo loading group. So the acute loading should generate more gastrointestinal distress, and so therefore the serial loading is safer, more effective, because the athletes can concentrate more on their bench press movements rather than their visceral pain or their visceral cramping or bloating. And you can see here, so we're exerting 70% of 1 rep maximum, and then, so the idea is that we're trying to reduce the perfusion of hydrogen proton cations, the lactate, lactic acid in the sarcoplasm. So the extra alkalinity will cause neutralization or the efflux of hydrogen proton cations from the sarcoplasm to the extracellular fluid. So there's a balancing effect for homeostasis, equilibrium. And here's a schedule showing like time arrangements. And for a 4 consecutive day period, so you have an acute loading group, serial loading group, and placebo loading group. So you have 3 groups. However, we're going to substitute weightlifting, bench pressing for the cycling. We're going to substitute that in, and the acute loading just has 1 single ingestion, where the serial loading has actually 4 ingestions. We're going to replace the placebo with a 4th ingestion, and then the placebo group always consumes the placebo, which is microcrystalline cellulose. And you can see here in the acute loading group, the bicarbonate that's free or available is much greater in the acute loading group, because the acute loading group has less time. Serial loading group has more of a balanced alkalinity, so there's an advantage. in ingesting the serial loading group over a 4-day period. And so in the methods, the subject participants will be resistance-trained athletes having attained the ages of 18 to 35, and they're moderately experienced, 12 in number. They can tolerate sodium bicarbonate. They are psychologically competent, well-trained, and thoroughly conditioned. They should have about a year or two of bench press movement experience, and they shouldn't have any serious pre-existing medical conditions like high blood pressure or any stomach ulcers or anything of that nature. And so the structure of the experimental design, you have a double-blind, placebo-controlled, randomized, counterbalanced design of 12 resistance-trained athletes assigned to 3 groups. And you've got a 4 consecutive day period comprising 3 weeks of loading. And then again, you have 3 groups: acute loading, serial loading, and placebo control groups. And they'll be arranged or identified in a within subject structure for a 3 consecutive week period. And so the resistance trained athletes will be assigned to one group for one resistance training event on a 4th day within a single week of time. So it's experience per week. You don't have all athletes conduct all 3 groups and within a single week. That wouldn't be beneficial or successful. So they'll be exerting 3 to 5 sets of bench press movements. They shouldn't exceed 7 minutes of high intensity bench press movements. But ultimately what will happen is each resistance trained athlete will experience 3 trials of supplements for 3 events of bench press tasks in 3 weeks of total time. And so we identify body weight as BW, and all the pills, supplements, ergogenic capsules, whatever, it will always be an equal dose for each individual athlete. So they'll have equal doses. They won't be incrementally increased or decreased. It will be an equal balanced dose. And so for our experimental procedure, you'll have an acute loading that's ingested as 0.3 grams per kilogram of athlete body weight and sodium bicarbonate. And but they'll ingest it on the 4th event day. The 3 consecutive days, they'll be ingesting the placebo. It's just on the 4th event day of bench press movements, then they ingest the sodium bicarbonate. And it'll be ingested in a 60-minute period. A 60-minute period at a time of 90 minutes before bench press movements or bench press tasks. And they'll be exerting 3 to 5 sets. And then for your serial loading experimental procedure, they'll be ingesting sodium bicarbonate every day. They'll be eating it with their breakfast, lunch, and dinner meals. And they'll ingest 0.4 grams per kilogram, so it's greater, 0.4 grams per kilogram of athlete body weight on days 1, 2, and 3. And then on the 4th event day, they'll ingest a special dose. I would imagine it will probably be 0.4 grams per kilogram of athlete body weight. So they'll be ingesting sodium bicarbonate for 4 consecutive days in the serial loading group. And then for the timing, so the sodium bicarbonate ingestion for the serial loading group commences at 90 minutes before bench press movement tasks. And the doses will be divided or fragmented up into 5 equal doses, and they'll be consumed in a 60-minute time period. And so therefore you'll have a 30-minute remainder of time before bench press movements, the bench press tasks. So the total time, you have 60 minutes of digestion assimilation plus 30 minutes of rest and recovery for digestion. And then you have a total time of 90 minutes before the actual bench press movement of the task. And then you have the placebo group structure. So for 3 days they consume pure microcrystalline cellulose exclusively, no sodium bicarbonate at all. And then they measure it. It's measured as 0.3 grams per kilogram of resistance-trained athlete body weight. And then on the 4th event day, they'll consume microcrystalline cellulose again. So, in essence, quintessentially, they're ingesting placebo pills between days 1 and 4 exclusively. They don't consume any sodium bicarbonate. And the number of capsules will be equal to the acute loading and serial loading groups. So they will ingest the same number of capsules. So the concept is to make it look identical. They're all ingesting the same thing, but in reality they're not. The athletes are in different groups, but they don't know it because it's double-blinded. So double-blinded structure. So no matter what, you always have 5 equal doses ingested 90 minutes before the bench press movement task on the 4th event day, or the event day number 4. So you allocate 60 minutes of digestion, assimilation, and swallowing, and then you have another 30 minutes without ingestion, but you're still digesting. So you have a total time of 60 plus 30 is 90 minutes. And so strict body form is crucial and critical, and that will be strictly enforced. But because the high intensity movement, as I mentioned earlier, 70% of one repetition maximum, so they'll be feeling stress in their chest and their arms, and so we anticipate 4 minutes of bench pressing movements will be optimally ideal. So that conforms to the 1 to 7 minute time period, and 3 to 5 sets will be exerted for high intensity breast press movement tests. And you can see in this picture, obviously the form is highly deviant. Her back is curved and arched and hyperextension, so that will not be allowed because it detracts from the chest and the arms exerting the bench press movement. Her lower body weight is being included to involve her legs and buttocks, so that's gluteus, so that's not to be allowed. So we're gonna have a disqualification for anyone who's non-compliant. So we're gonna tie a rope, a cord, or a string of 72-inch length, 6 feet, and then tie a 2.5 pound weight disc or plate to the thin rope, and then they'll be wearing it around their mid-waist, and if that moves at all, especially if it's substantial, then the resistance trained athletes will be disqualified, so we're not going to allow that. And then questionnaires can evaluate visceral gut and gastrointestinal distress, so we can ask the athletes how they felt subjectively. But we won't be extracting any blood samples or anything, or urine samples. Strictly a subjective questionnaire based on what's sensed in the visceral gut. So we have the IBMSS software program, and it's going to measure the data analysis. So we have 3 consecutive weeks of bench press movement tasks that are, and those bench presses will be compliant in continuous repetitions, and 3 to 5 sets for each individual athlete. And so we have a counterbalance arrangement manipulation of the acute loading, serial loading, and placebo loading groups. Again, the acute loading group ingests 0.3 grams per kilogram of athlete body weight on the 4th event day. However, the serial loading group will have 4 consecutive days of ingestion of 0.4 grams per kilogram of athlete body weight in sodium bicarbonate. And so, and the placebo group will always ingest microcrystalline cellulose. So, so the doses will function as our independent variable. We can manipulate those. And then for statistical analysis, you've got 3 groups: acute, serial loading, and then placebo, and then the 4 athletes per group. And then you have a 3x4 matrix, and you'll have 3 to 5 sets of exercise. And it will analyze the repeated measures within subjects for a number of repetitions, and then you'll also have an analysis of variance and pair t-tests to measure the change in repetitions between the 3 groups. So you'll have 3 counterbalance groups involving 12 athletes, and statistical significance will be determined at a p probability of less than or equal to 0.05 or 5%, and so resistance trained athletes who are in the serial loading group are expected to exert the greatest number of bench press repetitions. So the serial loading group will exert 3 to 5 more sum total repetitions on the 4th event day within 3 to 5 minutes. Resistance trained athletes will exert 3 to 5 sets of bench press movements tasks. So we expect more repetitions with the serial loading group. However, the acute loading group should experience a greater gastrointestinal distress. And then we expect in the acute loading group a greater number of bicarbonate and lactate molecules because they haven't been stabilized and combined with any other substances, so they'll be proliferating. And resistance trained athletes in the serial loading group should experience the least, lowest, minimal, or they won't experience any gastrointestinal distress at all. However, the acute and serial loading groups should be able to demonstrate greater repetition counts in contrast with the placebo loading group. So again, serial loading will be the safest and most effective supplement regimen, and because they have more time for digestion, assimilation, protein synthesis, phosphorylation, etc., the cells will have more time for all of their activities, not just the bicarbonate metabolism, but they'll have more time to adapt in the serial loading group. And of course, all these bench press repetitions and movements will be compliant. And so in conclusion, as an anticipated result, we expect that the serial loading group athletes will exert greater work than the acute loading or placebo control group athletes. Serial loading groups should exert greater work because they're exerting greater number of repetitions.